Hello, my name is Joseph Tsuma, always your favorite doctor. And when you see me here, it is Matters Health. I'm here to bring you trusted health information wherever you are. You can follow me at a personal level for simple, updated medical insights that will be able to keep you and your family healthy. You can also follow us. You can also follow me on YouTube at Dr. on Wheels, but also on TikTok at a personal level at Dr. Itsuma. And today I want us to look at maternal request as an indication for cesarean section. Now, of note is that this basically today's topic will be addressing more on the doctor rather than the client or the patient. But before we dive into today's topic, let's listen to some words of wisdom from the book of 1 Peter or 1 Peter, chapter 2, verse 24. And the Bible says, He himself bore our sins in his body on the tree, that we might die to sin and live to righteousness. And this is my favorite part, that by his wounds we have been healed. By the wounds and by the blood that was shed on the cross, we have been healed. What a wonderful encouragement today. So let us dive into today's topic. So cesarean section on maternal request refers to a planned cesarean section or a planned cesarean delivery on the mother's request. Okay, so the mother requests to deliver via cesarean section without any medical indication. So when you look at all the medical indications, we do not have something we can pin it down and say that because of this, then we are obliged to do a cesarean section. Okay, now today we will be wrapping up on the maternal indications, and then next time we will start with the fetal indication for cesarean section. Now, as I have said or alluded earlier, is that this topic in itself today will be addressing mostly on the concerns from the doctor's side and what exactly we as medical professionals are supposed to do, especially when we find ourselves in such a situation where our patients are requesting to deliver via cesarean section when there is no any documented medical indication for us to be able to proceed with this procedure. So this procedure needs to be done after full counseling, okay, and informed consent. So you need to counsel your patients very well. Everything needs to be documented, okay, and you need to have a fully informed consent. This patient needs to know exactly what they are signing into. What are some of the complications and everything? So, which is something that we will be looking at. Now, these are some of the reasons, or these are some of the concerns that we as doctors need to be able to address to our patients, especially when they come to us and they are concerned that they are requesting us to be able to help them deliver via cesarean section. So number one could be the fear of labor pain, okay, what we call tocophobia. So our patient might come here and probably at one point they walked into a maternity ward and they saw how those mothers were crying because of pain, and they became phobic, okay, and they are fearing the labor pain, so which is a concern that we need to be able to address. Number two is previous traumatic vaginal delivery. Probably this mother had a traumatic vaginal delivery previously and they fear, okay, they have that fear. You need to address that not all the vaginal deliveries are the same, okay, and the fact that they had a previous traumatic vaginal delivery does not mean they will have another traumatic vaginal delivery, and it doesn't mean that because of that the cesarean section will not be traumatic or it will not be chaotic. Number three is probably perceived safety for the baby. So here is where probably the mother had a previous experience with their previous baby. Probably they ended up with an intrauterine fetal death, okay, and they became very skeptical, okay. So for this current pregnancy, they fear that probably the safety of this baby will not be okay, okay, so they would want to just deliver via cesarean section. It's a concern that needs to be addressed, okay. The other thing is probably they are thinking of convenience and they want to have control over the timing of delivery, okay. So convenience, you want to make a decision on when you want your baby to be born, okay, or you probably want your baby to have a specific birthday, okay. You probably might want all your babies to have their birthday on the same day, okay, or you have some serious concerns, you want to be controlled when exactly do you want to give birth and all that without any medical indication, which is a concern that needs to be addressed. And the other thing is probably previous psychological trauma and sexual abuse, okay, that needs to be addressed. Good counseling needs to be done. And then patients who have had infertility, especially, and then they ended up getting pregnant. So this baby is a precious baby, and sometimes they might be skeptical, thinking that probably vaginal delivery might increase the risk of complications and all that, which is a serious concern that we as doctors need to address it, okay. And then last but not least is cultural and social influence, okay, that can actually make people to be very skeptical and they just want to deliver via a cesarean section. Now, there are medical ethics that we as doctors need to be able to uphold even as we make decisions on conducting these procedures, okay, of delivering this baby. So number one is the patient autonomy. So the patient basically has a say on what they want, okay, and we as doctors, we need to respect that. We need to respect that the patient wants this cesarean section, and therefore we need to do our due diligence, okay, of ensuring that we inform them well on the complications, we inform them on the benefits, and they are aware of what they are signing into. Number two is we need to act in the best interest of our patients, what we call beneficence, okay? So whatever we do, okay, we need to act it at the best interest of our clients, okay? So they might have made their decision that they want to do this cesarean section, but even if you have to do it, you need to do it at the best interest of your clients. Number three is you need to avoid harm, what we call non-maleficence. So in everything that we do, okay, even as we consent to helping this mother to deliver via cesarean section, we need to always avoid doing harm. And number four is we need to uphold informed consent. So what does it mean? It means that we must do thorough counseling of our patients, okay? They need to understand the benefits and the risks, and anything that is involved in cesarean section must be discussed. They need to be able to air out their concerns. You need to address their concerns, okay? And everything that you do must be documented. Everything that you say to this patient must be documented, and they need to give an informed consent that they have understood the risks, they have understood the benefits, and they are willing, okay, to to still commit to go in for a cesarean section. Okay, that is informed consent. Now, what are some of the counseling that we need to do, especially for our patients? Number one is you need to explain to our clients the benefits, okay, of both methods of delivery, both the benefits of vaginal delivery and the benefits of cesarean delivery. But apart from that, you need to also discuss the surgical risks, of cesarean section, which may include excessive bleeding during the time of the procedure, risk of infection, okay, or even the risk of organ damage, especially when you go in. You can easily injure the bladder, or you can easily injure the ureters, okay? You can, or the ureters, the urethra, okay? So they need to understand that there is a certain percentage of risk that they need to be willing to take. Okay, and the other thing is you need to counsel them and ensure that they understand, okay, all this, and they have made that decision voluntarily, not being coerced by anybody. Okay, but also the other thing is we need to address their psychological issues. So you need to psychologically support them so that they are able to understand, and we need to also work with them. So number 4, we need to provide good antenatal and postnatal care and continuity of care even after they have made the decision that they want to give birth via a cesarean section. Now, I feel like I need to do a separate video on the advantages of vaginal deliveries and their risks, as well as the advantages of cesarean section and their risk. But for the purposes of this video, let me just run through some of the advantages and the disadvantages of cesarean sections, okay? So number 1 for the mother, okay, is you will be able to avoid they will be able to avoid labor pain. Okay, so for you as a mother, you'll be able to avoid the labor pain. Okay, but there's a catch. Okay, so you can avoid the labor pain, but you will never avoid the scar pain. Okay, because after that cut, okay, after the anesthesia has worn out, okay, you will start feeling pain at the incision site. Okay, so it's which poison you want to choose. Okay, number 2 is that you prevent injuries to the pelvic floor muscles, okay, because of the contraction and the baby as they come out. Sometimes you can have injuries to the pelvic floor muscles, okay, and therefore cesarean section can prevent that. And number 3 is it helps to prevent perineal tears. For the baby, you have the advantage of predictable timing, so you can actually predict the time at which this baby is coming, and therefore for better planning. And then the second thing is lowering the risk of intrapartum distress or complications. So during the process of delivery, there are some distress that the baby might go through, which are very beneficial, by the way, to the baby, okay, but then some of them can be avoided by a cesarean section, and then the immediate neonatal care that needs to be given to this baby as well. Now let's look at the disadvantages of a cesarean section that is not medically prescribed. So number 1 is you are running the risk of increased bleeding during the procedure. So you might end up with antepartum or postpartum or intrapartum hemorrhage, okay? And you're also running the risk of infection, especially infection at the incision site, okay? And that one basically can lead to longer recovery, so you will take longer time before you recover to the non-pregnant state, okay? But 2 is because you run a risk of surgical injuries, okay? Injuries to the bladder, injuries to the adjacent organs around the uterus. And number 3, you run a risk of getting a risky pregnancy in future, okay? Like run a risk of placenta accreta, whereby the placenta basically invaginates all through the muscular part of the uterus, okay? Or even uterine rupture in your next pregnancy because the scar is a weak place, okay? And then the neonatal risk include respiratory distress, so your baby is at risk of respiratory distress. And then risk of prematurity, especially if the doctor did not calculate your dates very well, okay? And then that basically can lead to possible neonatal ICU admission, okay? So those are some of just in a nutshell, the risks that are involved with a planned cesarean section that is not medically prescribed, or what the mother basically requests, okay? Now, if everything has been, the due diligence has been done and everything has been, the mother has been advised and they have opted for cesarean section, okay, so it should be performed at 39 completed weeks, okay. That time we are very sure that the baby is fully mature. Now, World Health Organization basically discourages unnecessary cesarean sections, okay, but still advocates for respect of informed maternal choice. So if the mother has been informed, okay, and they have still insisted that they want to deliver via cesarean section, World Health Organization recommends respect to that decision. Now, we have other bodies like the American College of Obstetrics and Gynecology and the Royal College of Obstetrics and Gynecology in UK, who have also put their input, especially on this matter, and they recommend thorough counseling, okay, and documentation of this counseling, okay, and psychological support, even as you consent for this cesarean section, okay. Now, um, we as medical professionals, okay, even after our patients have consented and they have insisted they would really want to perform a cesarean section, we need to maintain an unjudgmental attitude. We don't have to judge them, looking at them because now they don't want to give birth normally. We need to be able to provide accurate information, okay, so that you don't basically give haphazard information because you want them to basically consent for a cesarean section because it's more beneficial to you, okay. But also we need to address the fears and the misconception that our patients might be having, especially during this time. And also we need to involve a multidisciplinary team. So you need a counselor, you need an obstetrician, you need a gynecologist, and all the people that are involved, so that we are able to maximize the output and basically maximize the outcome of these procedures. And finally, we need to ensure safe surgical and postnatal care. Now, if you have found this content very useful, please consider following us here on TikTok. You can also follow me at a personal level at Dr. Itsuma, both on Facebook and Dr. Itsuma here on TikTok, but also Joseph Tsuma on Facebook and Instagram. Now, we do online consultations, so in case you have any consultation, you can always reach out via our numbers, which are on the bio, and we'll be able to help you out. But for any question or consultation, you can also visit us at Zawadi Premier Healthcare. We're located at Loops Hill Center, ground floor, opposite Juanco Petrol Station, okay, at VET in Ngong Town. And I'm sure we'll be able to attend you well. Until next time, God bless.